everyone, welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I am going to talk about a research that was recently released by the researchers from the Institute of Clinical Microbiology and Immunology at Sir Ganga Ram Hospital. And the research that I'm talking about is published in the current edition of the Indian Journal of Medical Microbiology. The research has shown some very interesting insights where it talks about the current scenario, which is the scenario where monkeypox arrives in India. Now, India has confirmed 9 monkeypox cases by the time this editorial was being written. The size of the outbreak clusters is growing each day as it is geographically spread across international borders. More interestingly, it is being recognized as a potent sexually transmitted infection as it is attributed to close contact with lesions with no intention of stigmatizing it. This zoonotic virus has a low level of endemicity since decades in West and Central Africa, which is the place of its origin. Now, since it has spread to 75 countries and more, joining with over 25,000 plus cases, WHO has declared it as a public health emergency of international concern on 23rd July 2022. Now, according to Dr. Sanghamitra Datta, who is the author as well as the senior consultant at the Institute of Clinical Microbiology and Immunology at Sir Ganga Ram Hospital, smallpox has no known animal reservoir and has only human-to-human transmission with a high mortality rate of 30%. Monkeypox is zoonotic, followed by human-to-human spread with average mortality of 3 to 6% as stated by WHO. Lymphadenopathy is distinct in monkeypox, which is not there in smallpox. Most experts agree that though infection can occur through respiratory droplets from a close contact, it does not seem to be transmitted over the distances like the SARS-CoV-2 virus. Speaking to Medical Dialogues about this issue, we have on board with us Dr. Wattal, corresponding author and the chairperson at the Institute of Clinical Microbiology and Immunology at Sir Ganga Ram Hospital. So firstly, sir, if you can tell our viewers or if you can tell us in detail what your research actually emphasizes on.
Sir, the emphasis is basically to make people aware as to what all this about monkeypox. We are, coming out of COVID-19. Many people think that, we are into another pandemic, which is not the case even in remote. So that was our main worry, that people should not be taking this as coming as another pandemic. There's no chance as it. There's nothing like that.
And the research also says it highlights the fact that monkeypox is not to be confused with COVID-19. What is your take on it?
Yeah, it's not to be confused, certainly not. These are totally two different issues altogether. And what we are talking about, both are zoonotic, but the way of spread and the kind of epidemiology and things like that are totally different. And here we are, basically, this is not a virus that has really adapted on to humans in a big way. But we knew for a very long time that monkeypox can infect humans, but rarely. But actually, you see, we are invading their domain more and more as we are passing the days. And you can see this is part of the global warming, that we are invading their domain. And obviously, we are coming more and more in contact with zoonotic viruses, and the viruses as they are getting more and more adapted to get on to the other mammals like humans, where actually we were being protected by a cross protective immunity with smallpox, which across the globe was only limited to humans, and that's how we could eradicate it, by actually eliminating this disease. But only thing is that when we found that younger patients are more likely to get monkeypox, this was one of the theses, one of the hypotheses, that probably these people, younger people, below 50 years, 40 years of age, probably have not had BCG vaccine, not BCG, but the smallpox vaccine at the time of birth, as it was being done earlier. So elderly people or older people, 60 above or 55 above, they were not in the list. So that is what the whole thought process in the medical community and scientific community started building.
And lastly, sir, what conclusions would you want to give out to our viewers?
Be aware, be conscious that there is something like this that has come to the country. Though recently these monkeypox strains have been already typed, and we know now that native strains have not been there. They have come from either US or the Gulf, and we need to be on watch out that it may not take very long if we are not careful that we may have even native cases. And then now that we know that the human-to-human transfer is also happening, which was not the case earlier. So that's the reason we are actually on guard. We're not alarmed or anything. We are on guard, and we should be keeping our mind and eyes open for this kind of an eventuality. So it's better to be prepared than say sorry tomorrow.
Thank you so much for this wonderful insight. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.